The leading preventable cause of infant death is suffocation. Suffocation occurs when a baby's breathing is blocked. The most important step you can take is to provide a safe, sleeping environment for your baby. Always place babies on their backs to sleep. Babies can breathe in more oxygen when placed on their backs.
According to the American Academy of Pediatrics guidelines, the safest position for a healthy newborn infant to sleep is on their back. And the reason for that being is that when an infant is on their back, that provides the correct alignment for their breathing and allows them the best air exchange and more oxygenation. When they're on their stomach, they're going to get overheated, which is going to place them into a deeper sleep, which is therefore going to, one, decrease their ability to arouse if they're not getting enough oxygen. And when babies breathe out, or when we breathe out carbon dioxide, and we breathe in oxygen. The carbon dioxide gas that we breathe out is much heavier than oxygen. So that carbon dioxide settles down around the baby's nose and mouth. And as this increases and the baby's taking in less oxygen and the carbon dioxide is going up, the level is being raised in the blood, slowly the babies will slowly start to slow down their breathing, and then eventually the heart rate will slow down, and then the baby will stop breathing and the heart rate will stop.
Families are encouraged to actually have the babies always sleep on the backs. That's one thing that has changed significantly.
Babies are born with a startle or a Morrell reflex, which helps them in their arousal state. So if their breathing is slowing down and their body is sensing an increase in carbon dioxide or a lower level of oxygen, this startle reflex will wake them up and they will cry and take deeper breaths, and it really adjusts for that. And then that's more prominent on the back than on their tummy. Anytime your baby is sleeping, they're to be sleeping on their back. Another way that they found is by using a pacifier. When a baby sucks on a pacifier, they're more easy to arouse. They sleep lighter. One generation ago, we positioned babies. Babies slept on their tummies. So aunts, grandparents may not understand that this is important, and they may feel the pressure of what they're recommending and that. So it's their time to make sure that the pediatrician is on their side and kind of educates their family members and that. Some of the reasons that parents may be reluctant to have their babies sleep on their back is, one, they feel that they have a concern that the baby may spit up or choke while on their back, although research done in many countries has proven that there is no more increased incidence in aspiration in babies who are sleeping on the back versus their tummies.
Make sure your baby's crib has a tightly fitted crib sheet and remove all other items. Remove all blankets, bumpers, pillows, and toys from your baby's crib. These items can obstruct your baby's breathing and cause suffocation. Never let anyone smoke around your baby.
We're looking for ventilation. That should be the key goal, is that the baby have as much oxygen as possible to breathe. So we are eliminating all the toys that they used to have, all the bumper pads, no blankets. And so really the only person or item in the crib should be the baby. They found that fans in the baby's room really increase the ventilation. And of course, we never want to have smoking in the home. Smoking decreases the oxygenation for the infant and is proven to be an increased risk for SIDS.
Secondhand smoke is just as harmful as the baby smoking his or herself. It causes upper respiratory problems. It causes problems with sleep patterns, and it causes some developmental problems.
Babies must always sleep alone in their own crib or bassinet. Babies must always sleep alone in a clutter-free, safety-approved crib or bassinet. Do not bed share with your baby. Many babies have died as a result of co-sleeping with an adult. Do not place babies on adult beds or furniture to sleep.
It's custom, and many times grandma has the say as to, well, all my babies slept in my bed with me, so it's okay for you to do that. Unfortunately, the leading cause of infant death in Florida this past year was co-sleeping, basically suffocation.
When we're talking about preventable deaths, we're dealing with people who care, who love their babies, who want to protect them, but they just need to know what's right and what's wrong. They just need to know that sleeping with that child is one of the most dangerous things you can do.
Now, the majority of maternal child health arena really advocates for mothers to not sleep with the babies or family members not to sleep with the babies and not to do the co-sleeping.
The crib or bassinet can be in the parent's room, but that the baby should not sleep with the parent in the bed. As a new parent, you have a new responsibility. It's no longer only about you. Your new role as a parent is to advocate for your baby. So now you need to educate anyone who cares for your baby the importance of sleeping on their back. And even if you run down to the store for 5 minutes to get a carton of milk or so, whoever cares for your baby needs to understand why your baby needs to sleep on their back, because infants who are used to sleeping on their backs and are then placed on their tummies have a much higher incidence of SIDS, or at much higher risk for SIDS. Same thing as premature infants, or infants have a respiratory infection, are more prone to SIDS at that time.